Indeed, I wish we had more time for almost each and every topic that we cover here at the Global Webit Impact Week as part of the day 4 dedicated to health innovators. But it is what it is. We have only 12 hours per day for the agenda, covering almost each and every country in the world with over 100,000 people from over 190 countries registered. Not sure if it's a morning, day, or whatever for every one of you, but what matters is that the topics and the content is truly inspirational and mind-opening. We have coming up next a fireside chat, AI in healthcare, expectations, reality, and future. And the person who is going to ground us and give us the best possible point of view, taking the most from the interviewer, is going to be Ryan Pryor from CNN.
Well, my name is Ryan Pryor. I'm a journalist with CNN, and I've been covering health science and wellness throughout the pandemic. And I'm delighted to be joined by Dr. Tina Manoharan, who's the vice president and the global lead of the Data Science and AI Center of Excellence and Digital Division of Research at Philips. And so we'll go ahead and jump right in. So Tina, as the global lead of the Data Science and AI Center of Excellence, she leverages data science and AI to support Philips Center clusters, businesses, and markets with the creation of smart connected devices, services, and solutions. She also leads the digital division of research in Europe, which focuses on, among other things, the Internet of Things, data science, and artificial intelligence. So Tina, let's start off with a question about your background. What were the most important choices that you made to become the inspiring leader and visionary that you are now? And what is it like to be leading with vision towards more innovative and advanced healthcare services?
Yeah, thanks, Ryan. So I'm excited to be here with you. And for me, I like the title as well. We talked about promise, reality, and future. And that also resonates very well for my own journey, you know? So working for a healthcare company, it's a commitment you make. It's about improving and saving people's life. And this is what motivates my team and me. And you realize, you know, the impact of what you do, and you can see that, you know, and you think about your parents, your children, your friends, and you know that they're all relying on this. So that's really motivating. And then you see the reality around you, and you still see, for instance, understaffed, overloaded professionals. You see patients lacking the access to care, or you know, sometimes you see even the processes. Even today, you have your own personal sort of bad experiences, and then you feel determined, you know, that you want to make a difference, you want to contribute. And for myself, I also had a personal experience which kind of woke me up. And when you're confronted with a life-threatening disease, and to share my own experience, and you know, there's one saying that you say, we have 2 lives, and the second begins when you realize you only have one. And this year, when I thought about that, I thought, hey, I'm so thankful to the brilliant surgeons who performed one of the most complex surgeries, at least for me, and MRI devices that really detected the disease so early, pathology tests that really detected the mutation in a timely manner, the surgical devices really for the precision treatment that they could do for me. And when you think about also radiation therapy that targeted every tiny cell to avoid recurrence, when you really think about that, you realize it was a miracle, and then you're so thankful for all the impact that you can make. And that motivates me, that energizes me to do much more innovation with digital, with AI solutions, because what we do can really create our future together. So that's what matters for me.
Yeah, and that gets to some of the questions that I wanted to ask you more personally about the doctor-patient relationship, and how does AI and have the prospect of changing how doctors can interact with humans to make it more personal or more empathetic if they have some of these other parts of it freed up. And based on your own personal experience, it sounds like, how has that changed the way that you approach your job?
Yeah, I mean, for us at Philips and also for me personally, the AI is a tool. It's a means of enhancing the human experience. And we look at it from, let's say, three ways. So first and foremost, it's how we can augment the expertise of the healthcare providers, because they're making so many decisions every day, from detection, early detection, to diagnosis, to treatment, monitoring the patient condition all along. And this is where AI can make a huge difference, whether it's radiologists or cardiologists. Let's say the diagnostic confidence we can provide, the consistency of standardized results we can provide with AI, like with segmentation, with quantification of information. That's huge potential. Likewise, think about it, if AI, let's say, can help detect early signs of patient health condition deterioration by leveraging all kinds of information, multiple vital signs, right? And really enabling a timely intervention, reducing the risk of readmission. That's how AI can really help augment a physician experience. Take, for example, in Netherlands, especially in the COVID time with many of the ICUs filling up and so on, this is one of the things that we believe we made a huge difference with the early deterioration of health conditions. So we significantly reduced, so something like 20%, we help reduce the mortality, 24%, we help reduce readmission rates and severe adverse events. So this makes a huge difference, right? So in other words, I'm talking about AI that can really augment a physician experience. But AI also has huge potential. So that's the second concept which truly drive to improve operational efficiency. There's so much more we can improve in the workflow automation, to standardize, to reduce unwarranted variations that we have today. Whether it's, again, like in the radiology workflow automation, so for example, significantly improving MRI scan time by auto detection of patient breathing, auto detection of patient positioning. So that's something we can do. Take another example, predictive maintenance of our own equipment. So imagine if we can significantly reduce downtime, prevent disruptions in the clinical workflow. That's huge. And at the same time, AI can help also on an enterprise level, really to manage patient flows all the way, let's say, from admission to discharge. How can you have an optimal patient flow in the hospital? So that's the second aspect we focus on. And the third one, really, it's about empowering individuals, empowering every individual. And you asked me for my own experience, right? So this is where I wish the health system was much better than what we have today. So every step of my way in the care journey, I wish I was empowered to have more personalized information, actionable information, that I can do something about it. I can manage my own health. I wish I could have detected that earlier. I keep thinking, could I have gone there before the MRI scan detected that? Was there an earlier point? So in other words, how can we empower patients even better? And I just wanted to take maybe an example from Philips, even as simple as oral health care. How can we have smart intelligence in our toothbrushes that really help patients manage better oral hygiene? And in one of the studies we did, we showed that, let's say, by detecting the gum condition or health condition, you can significantly reduce periodontitis. You can reduce something like 90% or more. With the recent study, we showed that you can really reduce the gum bleeding. And that's huge, that people are empowered to take better care of their own health. So that's what I would summarize. What I truly believe in, and what the Philips data science and AI team really working towards, is how can we, in the end, holistically enhance the human experience with AI.
That's amazing. I want to also just address this elephant in the room of the last year and a half of a global pandemic. And which has put healthcare systems under more pressure than you know, any of us could really have imagined. What are some of the most important lessons that you've learned during this critical period on how COVID affects healthcare in the long term? Or
I guess, we've read everywhere and everybody's talking about it, like how the pandemic has really accelerated the adoption of digital health. And we've experienced that also at Philips and in our teams, and how technology can really help. We can drive further momentum in some of the trends that were already underway, and digital transformation, what you see, is now in the top of the mind for many healthcare leaders. We did a survey and interviewed many clinicians around. I mean, this is what they're saying. This is in their own charter as well. Mm-hmm. And let's say with AI-enabled solutions, whether it's as simple as being able to triage who needs to have prioritized care, and also being able to keep their patients and staff safe. That's very important. And the pandemic showed that you need to consider everything. Going from another Netherlands example, maybe taking a totally different one with the partnership and work we've been doing with Australia. Australian hospitals. So especially to reduce like the COVID-19, like let's say the transmission, to also reduce the pressures on the resources and so on, we gave patients tablets and medical devices that they could monitor and measure their own temperature, the blood pressure, the oxygen levels, So this means, again, we enabled and empowered the patients. And this way, we showed that there was significant reduction, something like 53% reduction of emergency visits. We showed reduction in costs for the health system. We showed reduction, something like 20, 25, or 28% in preventable rehospitalization, So this is where we learned a lot of things, and we also partnered a lot with many hospitals in order to learn new things, especially what we saw, like many others saw, telehealth, remote patient monitoring turned from a novelty into a necessity, right? And we also have solutions where you have the command center, or let's say the central hub kind of approach. So even, the page, let's say not only the patient, but the staff don't have to put their own health at risk. They could monitor patients from, let's say, the central hub. And that was also important. Another lesson, it's about accessibility. So we talk about improved outcomes, lowering costs, patient and staff experience, but at the same time, accessibility to care is so critical. So again, the work with Australia showed that by having, let's say, mobile clinics with diagnostic equipment and so on, that enabled people with limited access to get better care from cardiologists, for instance. Last but not least, I would say people saw the potential, and clinicians and health leaders saw the potential of leveraging the data, leveraging the insights for better healthcare. So they also recognize, we got to improve data sharing. We got to improve sort of care collaboration. And this also raised a lot of discussions and committees and so on, where we are joining forces to make this change. So lastly, I would say a lot of learnings from the pandemic for many of us, including us as Philips. It's a unique opportunity for us to embed more digital, more data and AI-enabled solutions into everyday healthcare practice. And to rethink how care is delivered. Patients are asking for it. The staff shortages demand it, and we know that technology can enable it. And this is what I would love to drive and accelerate further.
So these experiences of innovating and trying new things are, inspiring and exhilarating. I'm curious about the process of scaling them up and like really implementing them and making them widespread across a whole system. And so what are some of the challenges in the market or challenges in the policy arena for helping do this patient-centered support, and what strategies can you do to make sure that this becomes part of the everyday experience for all patients.
Absolutely. I mean, first of all, if we are not able to bring it into the clinical practice, right, there is no scale of adoption. So to be really successful, we think of it, I mean, there are many pillars. So let me just focus on, let's say, 4 main pillars that I want to highlight what scaling AI means for us. So first and foremost, as I said, it needs to be embedded in the clinical workflow, in the routines of the healthcare providers and patients. You cannot have AI as a solution in completely different place. You got to have it in the point of care or in the workflow where you're making the decisions. That means interfaces have to be intuitive. It needs to be frictionless experience. And let's say training and education is also an important aspect. Earlier, you also talked about what does it mean for a patient, right, to adopt AI? I mean, of course, they would want to feel trust in the insights and the solution that the AI is offering. So we need to also train and educate the healthcare professionals so they know how to get the most out of AI, and also to be able to explain and bring the confidence also in their patients when they're using such solutions. Let's say the second factor is, in order to create trustworthy AI solutions, we need to make sure that we also have high quality data, high quality ground truth, and properly annotated data. And this means today we have a lot of siloed information. So how do we really aggregate that data? I mean, this is where we have developed our Health Suite digital platform, where we really have open data standards in order to be able to aggregate, integrate, and get the semantic interoperability, semantic meaning of data in order to, let's say, scale AI propositions. And you got to make efficient use of the resources, whether it's the data, whether it's the AI models, or even the compute, especially when you're deploying the AI solutions in the cloud. The other thing which we're also doing is leveraging a lot of the next-gen AI methodologies or techniques, for instance, like federated learning. So learning from a wide number of clinical partners by deploying the model at the hospital and not by taking data out, which is not what we want and in all cases. And we want to make sure that data privacy is ensured. And other techniques like we call it hybrid modeling or hybrid intelligence or composite AI, so where you combine different techniques of AI in order to get more precision and do that in a more efficient manner. So that's a sort of the second pillar. It's really about getting access to high quality data in order to really have high quality, reliable AI propositions. On the let's say the third aspect when it comes to scaling and wider adoption of AI, again, we need to bring trust in the solution. In other words, we have to avoid, for example, unintended consequences or bias, because that would only widen the inequality. So we really have developed our Philips data and AI principles. I think many of the companies in the leading edge of AI, they have their principles, and the trustworthy AI or responsible AI is one of the major ingredients. And this is also something we bring in guidelines for our own AI development. Maybe the, let's say the fourth and the last point I wanted to bring here is the end-to-end solution. So hospitals are not looking for, let's say, a lot of point solutions, a lot of individual AI solutions. What does it mean to create this end-to-end solutions, integrated solutions, right? So interoperability is key, and to make sure that we are also looking into different techniques, like having a software marketplace where you can leverage different AI solutions. And then we are also working not only with our own offering data, right, seamlessly integrating and interoperable with other IT systems in the hospital. So this is essential. So I would really summarize that as, these are the 4 maybe key priorities that we have, things that we have to overcome. And of course, there are many other things also in our journey towards scaling AI, but I would like to maybe stress on these 4 at this point.
Yeah. So we've got a little over a minute left, and so I've got a couple big picture questions here, and coming in, so to close out the what's your vision for the coming decades, and predictions for healthcare on a global scale, and maybe just a couple of sweeping thoughts on what does the future hold for all of us?
Yeah, I guess we all have our visions and dreams, so I could talk a lot about it. I'm really passionate about it. I guess you too. So for me, since we see that AI has a huge potential to make a difference to people's life, we see the overstretched staff, and we know that we can make a difference. And of course, there are challenges to overcome, right? But my let's say how we think about it, or my vision as well. So in the end, it's we need to connect. It's an intelligent network of care. So connecting, let's say, care across different settings. And what we say is, when I think about the future of healthcare, I think of your care your way, right? Or in other words, right at the beginning, I talked about even my own experience. And then as a patient or a consumer, I would think of my care, my way, personalized, right? So I know how best to manage my health. And this is where we can go from, let's say, managing the sick to being proactive and really true healthcare. And this is where I would say end with dream of, let's say, my imagination of a true patient's digital twin. And I probably am not the only one. I see many others talking about it, but I really like it. I really feel if we can integrate different information of the patient over time, you have a digital twin of yourself. You can look at, you're looking at your watches nowadays, and you can look at your whole information over there and think and see what can you do better for yourself, what function, better understand how your body is functioning, right? So ultimately, it's about a lifelong personalized model of a patient that is updated with every measurement, every new scan, you get a new updated information. Like a surgeon once said, I see the digital patient as an opportunity to bring together all the information about a particular patient that could support themselves to maintain their own health. So prevention, it can support diagnosis, it can support treatment and planning, better targeted therapy, and in the end, it's better lifestyle, right? And that's my dream. And well, we already have the first proof points. So we have one of the Philips heart model, and here you can already look at the function of a personalized heart, for example, the ejection fraction or the cardiac chamber quantification. So we already have that, and it's only the beginning, and we can really look at a personalized digital twin. That's my imagination, and I hope it's not far off. I hope it's very soon.
So it's a beautiful patient-empowered future where people can make this, use technology to take decisions into their own hand and live the best life that they want to live.
Exactly. And have an intervention when you need an intervention. You need it, but you get the right care at the right time, and then you know how best to manage yourself afterwards. So that would be wonderful.
Okay. Great. Well, and Dr. Tina, thank you so much for joining for this Fireside chat, and I look forward to many incredible things in the future, and would love to be in touch.
Thank you so much. It was wonderful talking to you, and it was a nice, fun fireside chat. Thank you.
Thanks.